Hi, everyone. Welcome. I'm just waiting for the attendees to join as we're on the time, and we'll start the webinar soon. Thank you, everyone. Hi, everyone. Thank you for joining the FIP Development Goal Digital Program. This webinar is about setting the goals for the decade ahead. As we're on the time and due to time interest, I will start the webinar and we'll hopefully have an array of interesting conversations to have. And please continue to introduce yourself in the chat. And then if you have any questions, you can do it in the Q&A. So to start the webinar, welcome everyone to the FIP Development Goal 2, Early Career Training and Strategy. Before we begin, I am Andrea Bruno Tome, for the ones who haven't met me yet. I am currently in Portugal working as an independent consultant. Previously, I have worked with FIP for many, many years in the education realm as an FIP program researcher and coordinator for the FIP Ed. And I've also, my previous work has been on Monash University in Melbourne. So I do have a lot of experience in competency frameworks, especially the GBCF version 1. And today we're gonna look at all of the good things that have happened with the competency framework and examples that you can take home and lessons learned from our speakers. But before we begin, let me just say, share some housekeeping with you. This webinar is being recorded and live streamed via YouTube, and you've seen that before when you've just joined. It will be available on the FIP website shortly. You can ask any questions in the box provided, and you can also introduce yourself in the chat. Please, we do encourage you to do that. Any feedback is welcome, at webinars@fip.org. Even if you have more questions, please do use that link or that email, and we will get back to you as soon as possible. Do become an FIP member if you haven't, if you're not so or haven't done so. And just to let you know also, you will receive a certificate of attendance by email this week. So in case you're wondering how to get this recorded that you've been attended, you will receive via FIP the certificate. So setting the goals for the decade ahead. So let's begin by shortly introducing this topic. It's a comprehensive online event series which provides coverage of the 21 goals events in 2021. The main aim of the digital events is to mobilize global pharmacy development and transformation through these development goals. By engaging our profession members and colleagues everywhere, we aim to provide a description, direction, and context for each specific goal. And today we're focusing on DG2. The intention is to monitor and to evaluate through data evidence and identifying priorities across practice, science, workforce, and education. So this set of events have been running since March and will be until the end of the year in December. An average of 2 events per month, particularly the busy September. As you can see, we will actually host 4 events, especially due with the World Pharmacy Week and the World Pharmacist Day in this month. You can all pre-register for all the events by visiting the events.fip.org, and we encourage you to do so and to have a look. we look forward to having you in the upcoming episodes. And I'm just going to plug this in because mine will also be, or the DG5 that I'm lead, I forgot to say, will be in October. So do dial in for that one as well, if you like competency-based approach. So the event outcomes really briefly is to describe the DG2 and its three elements, so workforce, education, science, and practice. We will have speakers to address all of these, to showcase FIP tools, evidence, and resources, especially competency development in this case, and to identify priorities across all of these three topics. The idea is to engage our members in activity to support monitoring and evaluation of this goal through data evidence. So do encourage you to keep questions in and keep introducing yourself. It's always nice to have that even in this virtual setting. So I'm just going to briefly tell you the speakers' names, and we will start shortly. So we will have Dr. Asma Al-Hakan. We will have Franciscus Cristianto, Ian Coombs, Belma Pelivanovic, sorry, Belma, and Anisha Sandhu. I do apologize. So one FIP goal, we can have no pharmaceutical care without a pharmaceutical workforce, and we can have no pharmaceutical care without a scientific foundation for the next decade. So before, just to give you an idea of the goals and what they are, because they were launched in September 2020. So 1 year ago, we've launched these goals, and so much has happened since then. As per our vision and mission, FIP believes that we can have no pharmaceutical care without pharmaceutical workforce, and pharmaceutical care without scientific foundation for the next decade. I do apologize. I think I repeated myself. So this is the goals. I'm going to share a video. Hopefully it will all work out. So just to let you know that we've just watched the video of the 20 goals in action. These 21 goals were built on the 13 workforce goals launched in 2016, and FIP used the same consensus-based approach to expand the goals into a set of 21, each reflecting elements of practice, science, and workforce and education. So let's start on FIP Development Goal 2, Early Career Training Strategy, what you've all been waiting for. So to start off, we are going to speak about the workforce and education element. And the idea is to engage pharmaceutical higher foundation training infrastructures in place for early or post-registration years of the workforce as a basis to help and consolidate initial education and training and progress initial education and training towards workforce, towards advanced practice. So the mechanisms we can do to have that is to create clear and purposeful education and training programs and pathways for foundation training, is to develop early career maps and frameworks to support a seamless transition into advanced practice, to develop structures, approaches to early career mentoring systems to support our novice practitioners to engage with peers and preceptors, including clinical practice and pharmaceutical sciences across the workforce, and also, as per usual, using data and evidence to support the investment of the early career training. So let me introduce, without further ado, our first speaker. Asma Al-Hakan has completed her PhD in pharmacy workforce development and an MSc in clinical pharmacy from the University College London. The MSc has been in diabetes care and education from the University of Dundee. The undergrad has been from Kuwait University. So Asma is currently our clinical instructor for Kuwait University. Asma, the floor is yours.
Thank you, Andrea, for the introduction. Good morning, good afternoon, and good evening, everyone. I will start with an introduction to our lovely team in DG2. With me, Dalia Badges, she's also an FIB lead for profession and partnership. Shepard Mehlaba is also a drug information pharmacist and research assistant from Zimbabwe. And our recent addition, Franciscus Cristianto, who's also speaking today. I would like also to draw your attention to DG2 Workforce Reference Guide, you can find it in the FIB website. And this guide collates all information, evidence, and expertise from the FIB to support our member with measuring progress, evaluation, and implementation for early career training strategies. Next, please. Just a short background about a valuable tool for early career training is the Global Competency Framework, and we can call it for short the GBCF. This was first developed in 2012 by FIP as a mapping tool to support the translation of pharmaceutical science within the component of practice, independently of the setting or sector of one's practice. That means it could apply to pharmacists working in primary care, hospitals, those providing direct patient care or even the indirect patient care. This tool is a starting point to provide guidance for foundation level practice and for further development into advanced practice. Originally contained only 100 behaviors grouped under 20 competency domains and 4 broad competency clusters. For the expansion of the pharmacist role in the last decade and also the increase in involvement of pharmacists in direct patient care, the FIB Workforce Development Hub realized the need to update and revise the GBCF, and the revision process were undertaken over 8 months from the core team, which is the leads for DG2 and also external experts. And the process was an iterative review process that ended in September last year. And the new version was labeled the GBCF version 2. The new version now contains 124 behavioral statements within 23 competency domains. However, the 4 broad competency clusters will remain the same. This is just to illustrate the revision process that were undertaken. Several revision phases started in January 2020 and ended in September 2020. Next, please. The new Global Competency Framework, the GBCF version 2, had 4 clusters, as I said, and there are new competency groups such as emergency response in cluster number 1, pharmaceutical public health. We have also new competency groups such as digital literacy and interprofessional collaboration in the professional and personal cluster. Next, please. Now I would like to move to our adaptation of the GBCF in Kuwait. And the adaptation process starts a national survey where we assess the relevance of the competencies to Kuwait context. This was also followed by decision maker focus groups to decide on which competency to include in the local framework. And we created the Kuwait Foundation Competency Framework in 2019, and we call it for short the KFCF. The full research was published earlier this year. After the creation of the competency framework in Kuwait, the Ministry of Health decided to implement a national foundation training program for early career pharmacists as a way to support them to master the competencies within the framework. And this program was seen as a step toward the advancement of pharmacy practice in Kuwait with an overall goal to achieve sustainable impact on healthcare improvement. One important component of the Kuwait Foundation program is utilizing the Kuwait Foundation Competency Framework to support pharmacists in their professional development and to help them to set goals for their career pathways, to identify the core attributes needed to perform their duties, and to set some expectations of what is required from them. Before national implementation, the ministry decided to run a feasibility study, a small-scale pilot study from March 2019 to August 2020, in a way to evaluate the effectiveness and visibility of implementing a structured continuing professional development training for pharmacists in Kuwait. In the feasibility study, we had 21 pharmacists from primary care and from hospitals that joined an 18-month training program started in March 2019. The program had several components, face-to-face and online sessions to introduce the concept of CBD to pharmacists as it's a new concept to pharmacists in Kuwait, and also to train them to use the KFCF as a supplemental tool for their career development. Each participant had to submit several CBD records to show evidence of their professional development and their utilization of the framework. We had several modes to assess and evaluate this study. We ran 2 focus groups with interviews with participants to understand more about their experience with the different components of the program. We also had CBD record content analysis to assess the progress over subsequent submission. Also, we had 2 online surveys to assess perception and satisfaction with the training program. This is just an outline of how we spread the workshops and the record submission. So we had a first introduction workshop and we had several deadlines to submit CBD record. Each was followed with immediate workshop to provide feedback and support to pharmacists. This is the focus group thematic analysis. We had identified seven themes. First of all, the participants reported satisfaction with the program, and also they reported that the program helped them in identifying and fulfilling their learning needs. And the CBD template that we used was also helpful for them to document their CBD activity. Participants also valued the continuous and frequent communication and feedback. Feedback from the instructors, and also they didn't like the CBD submission deadline. However, it was needed for us also to evaluate the study and for them to assess their progress throughout the program. Participants reported several barriers to CBD. One frequent reported barrier was lack of appreciation from their peers and from their managers. Finally, we have also identified important and useful suggestion for larger scale implementation, one of which is the include CBD in the pharmacy college curriculum. Next, please. This is just part of the CBD record analysis, and I would like to highlight the focus of the CPD submission that we had from the first and second submission. And we noticed some shifts from the focus of the CPD activity that participants undertaken. In the first submission, the focus was in cluster 1 and 2. However, this focus was shifted to in the second submission to cluster 1 and 4. And participants reported that they weren't aware that other competencies would help them to improve their services to their patients, such as competencies included in the professional and personal cluster. Next, please. This is a snapshot from the survey that we had. We ran it twice in the middle of the program and also at the end of the program. And it's total, we had a very positive feedback from pharmacist participants. Important thing that we had looked at is the use of self-assessment tools such as the framework. And participants reported that it was really helpful to practice and identify their strengths and weaknesses and areas for improvement. Also important point for us is the educational activity that were done during the workshop, and we also had a good positive feedback from participants that this helped them to enhance their knowledge, skill, attitude, and values. This is my last slide. I would like to highlight some lessons that we had learned from this feasibility study. This small-scale study helped us to identify some of the infrastructures needed for early career training and education in Kuwait. From our experience with pharmacists in Kuwait, we know that CPD delivered during protected time would help participants to meaningfully engage in their CPD and professional development rather than doing it out of hours and to make it as a burden on pharmacists. Also, we as pharmacists needed support to have the essential knowledge and skill to identify their learning needs and act upon them. Also, we found that the KFCF or a developmental tool would help pharmacists to reflect on their current practice and guide them to identify their learning gaps. We used several flexible modes of delivery, including face-to-face and online training, and this helped us to sustain the program during COVID-19 pandemic. Written and verbal feedback and continuous communication with participants by a different platform were really helpful, and participants frequently reported that also supported them during the duration of the program. Spreading the program over 18 months was seen a reasonable period because this have allowed the participant to adapt to new behaviors, especially that CPD documentation and recording is not a concept that pharmacists in Kuwait knew before. So it's a new concept, and this allowed them enough time to apply what they learn in their practice setting and also to become familiar with the concept and to apply the CPD cycle along with application and evaluation steps. Thank you very much for listening, and I'm handing over to Andrea. Thank you, Andrea.
Thank you, Azma. So lovely to hear all about the Kuwait experience. Please start doing the Q&A on the chat. We will address them at the end, but if to keep it fresh, if you have some questions, please just add them as we go along. Thank you, everyone. And now for our next speaker, let me introduce to you Francisco Cristianto. He is the coordinator, CPD coordinator for the Indonesian Pharmacist Association. He's also the National Project Officer for the Workforce Transformation Program, a collaboration project between the Indonesian Pharmacist Association and FIP to develop early career training and advanced pharmacist programs. He's currently also the lecturer at the University of Surabaya. And thank you, Francisco, for joining us. The floor is yours.
Thank you, Andrea, for the introduction. Hello, everyone. And in this session, I want to share about Indonesia's journey in starting the workforce transformation program with the FIP support. We started by preparing training for early career pharmacists, which would later be followed by advanced level program. In this slide, I want to show you that Indonesia has nearly 63,000 pharmacists who are currently actively practicing until 2020 to serve around 270 million population. 50% of them practice as community pharmacists. The rest of them are practicing in hospitals, pharmaceutical industry, wholesaling, academic, and regulatory bodies. And every year, there are about 6,500 up to 7,000 new registrants nationwide. This is a challenge for the Indonesian Pharmacists Association, or IAI, in maintaining the competence of its members so that they are able to practice professionally. Next slide, please. Next, Andrew. Thank you. Prior to 2010, the pharmacists in Indonesia had no obligation to attend any continuing education or CPD activities. But after 2010, IAI began to require its members to start accumulating 150 points in 5 years as a condition of ROE certification. These points can be collected through various activities, such as professional practice, continuing education, publication, community services, education, and training. All activity history of each members will be recorded in the Pharmacist Information System, or we call it as SIAP, as shown in the picture in the slide. Next slide, please. This credit point collection system has been going on for a decade now. With the system we have like that, it will have an impact on the development of professionalism, career pathway, and the recognition system of the IAI's members. Pharmacists who have been practicing for decades and even until their retirement do not seem to have experienced the significant development of their expertise and professionalism. As for the pharmacists who develop independently, they cannot be appreciated more properly because there is no clear recognition system. Next, please. We realized that we needed to improve the competence of our members. And as a member of FIP, IAI tried to use the Advanced Pharmacist program as a benchmark. Initially, we planned to immediately implement the Advanced Pharmacist program for our members using the GADF as a guiding framework. GADF is the Global Advanced Development Framework. It's a validated tool intended to support the professional development and recognition of the pharmacy workforce everywhere. When our colleague, Shirley Melianti, asked pharmacists in Indonesia to rate themselves at which level they were among the 6 GADF clusters, she found variation in staging across the GADF clusters. From this finding, it was found that most of the pharmacists considered themselves to be still at advanced stage 1, indicated as a blue bars, and stage 2 with the orange bars. And some of them even put their competency as an early advance or early career, indicated as a yellow bars. And finally, we suggest that for pharmacists who practice less than 2 years, it is recommended to take a foundation training. Next slide, please. Based on the study result conducted by Shirley in the previous slide, IAI plans to define 4 stages of career development or advancement for pharmacists during their professional career, starting with the early advanced pharmacist, then progressing to advanced level 1 to advanced level 3. To achieve this advanced practice, IAI uses an adopt and adapt methodology from the practical model that has been prepared by FIP through the Workforce Transformation Program, or WTP. Next, please. In April 2019, IAI stated its commitment to be involved in the WTP. This commitment was then formalized in the form of MOU, which was signed at the FIP Congress in Abu Dhabi in September 2019. Next, please. As the first step that needs to be taken by the IAI is to form National Project Officers, or NPO, consisting of 5 people. They are from Ministry of Health, Professional Association, and also universities. The first program we prepared was train the trainers, because in order to train more pharmacists, we need many other trainers to help IAI accelerate the implementation of WTP. Next, please. The first train of the trainer was held by FIP and IAI for 3 days in November 2020. This online event was attended by 62 pharmacists in Indonesia. The main goal of the trainers is to provide support for IAI trainers and to explore development strategies for a patient-centered approach for pharmacy trainers. Next, please. Train the Trainer is brought by experts in FIP, and some of them are also with us today as speakers: Dr. Asma Al-Hakan, Professor Ian Coombs, and Dr. Dalia Bajis. Thank you to all of you who have helped train aspiring trainers in Indonesia. Yeah, next, please. The Train the Trainers activity went well and satisfactorily for the participant. They also gain additional knowledge and feel deeply connected to their daily practice. And in fact, they will also recommend this activity to other colleagues. Next. Some feedback from the participants that needed to be followed up by the IAI include they ask for follow-up activities and they need more training. Next, please. Following up last year's Train the Trainers, we again invite participants who have attended the previous TTT to participate in this year's follow-up training. The focus of this year's Train the Trainers this year is to encourage participants to practice in preparing their own learning plans after successfully identifying their learning gaps. In addition, they also asked to document their plans and learning outcomes in a portfolio document that has been prepared by IAI. This training has been held last week. Next, please. Lesson learned from our experience. And career pathway is useful for us for developing competencies and recognition system for our members. And it's better not to jump straight to the advanced level and start with the foundation or early career training. Adopt and adapt methodology provides a model as well as flexibility to match our need and priorities. And we have used this method to in implementing establish the Indonesian Advanced Development Framework and also conducting the Train the Trainers. Multi-stakeholder involvement is also required in implementing the workforce transformation program, and compliance with the guidance and advice provided by the expert of the FIP is important. For the next steps, we will develop a competency framework for early career pharmacists and conduct a pilot program to implement it. And finally, we may say that Indonesia is a country on a journey. Thank you for this opportunity to share our experience in implementing workforce transformation program in Indonesia. And now hand you back to the moderator, Andrea. Thank you.
Thank you, Franciscus, and thank you for sharing the whole journey and the lessons learned you have from a country. What an inspiration, without a doubt. We're now shifting a little bit of gears and moving on to the practice element, which is meant to provide training strategies and infrastructure, providing structural journeys for earlier career pharmacists, practitioners, including and pharmacy support workers, linking towards advanced practice and specialization, workforce, and professional recognition and certification. A little bit of the mechanisms that are used or meant to be used to support is develop structured opportunities for in-practice early career training, provide career and mentorship support for early career pharmacists, providing also appropriate conditions for reconciling early career practice and personal circumstances with education and training pathways and programs, providing also incentives, recognition, and certification of practice development. Without further ado, let me introduce you to our next speaker, Ian Coombs, not Ianto, Ian Coombs, appropriate name. Ian is a professor, is the director of pharmacy of Royal Brisbane and Women's Hospital, and he's also a professor at the University of Queensland. For those who know Ian, you know that this will be a fabulous presentation, and I will allow him to introduce a little bit of himself furthermore with a graph. There you go. Ian, the floor is yours.
Thank you, Andrea. And in the absence of my learned colleague, Professor Ian Bates, I thought it important that we have some science, and we can always like a nice graph. I'm very fortunate that my career, as you can see, was very linear. I began as a university student in London, and I went through some basic training. My life went up and down. It then went round in a circle, did a bit of a backflip, and somehow or other, after a lot of hard work, I somehow managed to end up in quite a highly recognized job. But a lot of it is also through great collaboration with my colleagues, Andrea and other colleagues at FIP throughout the world. So what I'm going to present to you today is really just a little bit about how in Australia, and I take things from a hospital focus because that's where a lot of my work's from, but it's increasingly being applied in the community and primary care sector, that it's really about structured journeys, but it's really something which I hope you can relate to in your own countries. We all have a lot of standards and policies and procedures, and they sit there. And if you just go to the next slide, Andrea, what we really want to think about is how do those standards and policies and procedures actually link to our workforce developing? So how, compared to the day they come out of university, do our practitioners actually continue to move forwards until, as Francisca says, the day they actually retire? And one of the key things is we know with adults is around evaluation, self and peer evaluation, and effective feedback, and having a development plan. And that leads to individualized training. In Australia, we're lucky that we have, if we just go back one, thanks. If we're in Australia, we're lucky we have now certainly a progression. Moving on, Andrea, to the next slide. Thank you. So we really can go through our undergraduate training, our intern training, and then we have our foundation residency, which happens both in a hospital setting and increasingly in our community settings as well. And then we go through a period of advancement. And what underpins those are a series of frameworks. So where do we get these frameworks from? We've heard already today, the next slide, we've heard already today that in countries such as Indonesia and Kuwait, we actually look at our own country standards. So you'll see that in Australia, we've had competency standards for decades, but they invariably sit on a shelf. They are not linked to what practitioners actually do. But what has been fantastic is that the components of our own standards, as happens in a lot of countries, can be linked to the global competency framework. And what we were managed to do in England, we used some of the early precursors of the competency framework to then look at what are the core competencies that are required for practitioners at a clinical level, at a professional level, at a leadership and a management level. And then how do we actually get those competencies using a tool which allows people to identify what we do well and what our gaps are, and therefore how can that help guide our needs-based learning? And we move on, thank you. So what we're really looking for, and what I think is important to all of us, and this slide goes back to our great friend David Webber, now at Guy's and Thomas's in London, is that what the patient sees and what our clinical colleagues see and what they expect is effective, persistent behavior. What we need to be able to continually think about is, what do people know? What are the skills that they have? How do they actually apply that? What are their abilities? And underpinning that, what are their values? And most importantly, how are their attitudes linked? So a competency framework needs to allow people to link all of these knowledge, skills, abilities, values, and attitudes back to what people actually do in the workplace, be it in their community pharmacy, their GP practice. I'm going to share with you, I still, luckily, as a director, get to go and see my pharmacist in practice. And I went to see one of our senior pharmacists working in our coronary care unit, a busy unit, 22 patients, 5 new admissions, 6 people going home. And I was using our tool, our competency assessment tool. And she was very good at assessing the patient's need. We had a patient who's going home. We had a medicine plan, and she really gone through exactly what medicines she would be on. What I noticed during our observation was that the lady, the patient, was on her own 3 days after a myocardial infarction, who lived 400 kilometers away, who happened to be in Brisbane in our hospital because she was visiting a son, had no car, no ability to get to a pharmacy, and the pharmacist was actually about to present an outside prescription, whereas we actually have a large in-hospital pharmacy. And what was one of our key competencies was to ensure continuity. The next slide, thanks, really was, if you go back, and this is actually going back to the original Global Competency Framework, but is how it's linked to our Australian competency framework in our hospital pharmacy setting, is there's a number of competencies there that you can all relate to: gathering, retrieving, identifying, checking, applying, and prioritizing. And this pharmacist did that very well. But what it really identified is the most important point, that this patient actually didn't have the ability for ongoing treatment. So thanks, Andrea, keep going. So really what I did was we sat down after we'd spent a couple of hours on the ward, and we're linking it back to this patient and a number of other patients, that what she did well was a history and identifying problems. These are all things that our pharmacists across the globe are doing or aspiring to do. What which he needed to do is consider that which were the patients who we really needed to take ownership on ensuring access to and the taking of medicines. One of the key roles that as a pharmacist we have to provide. And one of the things perhaps to stop doing was thinking that to enable her to get through all of her work, she could give the prescription to patients who would successfully get them outside. So from a keeping, starting, stopping perspective, this is, from my perspective, how in practice we apply these competencies tools to directly link to patient care. Next slide, please. So what's really important is, you could say that if you click the next one, that as our pharmacists grow from interns to registration to general level and advancement, they can develop these knowledge and skills individually. But I think what's really important is, above these base level common knowledge and skills, we don't actually just need people who advance to a level of expertise. Because if you go to the next slide, what we're now developing, as following on from a lot of other countries, Europe and America, is we have primary care-based pharmacists. This is actually Chris Freeman, our president of the Pharmacy Society, a couple of years ago in his GP practice. We have pharmacists assessing people before surgery, seeing bone marrow transplant, heart failure, kidney disease, helping with smoking cessation, epilepsy, etc. We actually, if you go to the next slide, have pharmacists in outpatient ambulatory rheumatology clinics looking after monoclonal antibodies, where they're doing the physical assessment of the actual patient and helping determine the treatment together with our medical colleagues. So the world has moved seamlessly from the hospital setting to primary care. And a lot of you can relate to this. But if you go to the next slide and think back to our competency frameworks, we don't just need these individuals, because the minute the individual leaves, the service stops. To enable us to maintain and sustain our workforce, we need to take our workforce with us. And this slide is there to represent that an advanced practitioner, or in some countries called a specialist, also needs to make sure we're putting back into the workforce and taking the rest of our workforce with us. So if you go on to the next slide, Andrea, this slide before showed how we have individuals acquiring knowledge and skills, but most importantly, they need to give back. We need to ensure that our pharmacists, and this is where the advanced frameworks come in, are providing education and leadership and management, and they're really taking on a higher level of responsibility and influence above the days where we used to look at individual competencies. And this is about advanced practitioners. And we're very lucky in Australia that we've done a key piece of work following on from our UK colleagues, and again, adopting the FIP tools around advancement and advancing practice. And we actually click the next slide, please. And we actually now begin to look at bigger domains above the core pharmacy competencies and looking at research, evaluation, leadership, professional practice, education, training. And we look at, if you click the next slide, we look at how pharmacists could contribute through research and publication and supervision and present cases and clinical practice observations, such as what I was just doing with my pharmacist in coronary care, and how we input to our meetings, committees, etc. And if you put all that, roll that up into the next one piece, which is our portfolio, that portfolio, which is our advanced practice portfolio, begins to pull over the years our evidence of pharmacists and impact, not just as an individual about our knowledge and skills, but about how we're putting back into our education, training, leadership, and management. And in Australia, we've had a process of recognizing that. But what that is doing is just showing that in a different country, in a different situation, we can apply competency models which are critical to be linked to self-assessment, peer assessment, feedback, which can then get a needs-based learning assessment for that individual, because we are all different. We all have a different need. And that can itself form part of the portfolio, which we've already heard about from our other colleagues today. And if you go on to the last slide, I think what I'd like to share with people is across the globe, we all treat patients with similar diseases who are receiving similar treatments and have similar pharmaceutical care needs, which means that we need to develop our practitioners to undertake the core pharmaceutical care competencies quickly and have a structured journey so that each individual gets to an acceptable level at an acceptable time. And competency-based performance evaluation and feedback, we know unequivocally, without going back through the original evidence, we know it speeds up individual development. And I'd implore you that by adapting our FIP competency frameworks and mapping them to your local standards will guide your workforce development, as we've heard from great case studies already today. And they're tools that will assist our pharmacists at general level, at advanced level, specialized level, as well as our pharmacy support workers and our clinical assistants and technicians. And these can all be guided by the same frameworks. And ultimately, our individual portfolios assist demonstration of our practitioners' development and impact. Thanks, Andrea, and thank you for inviting me.
Thank you, Ian, and lovely presentation as always, to showcase what Australia has been doing and also the key message to take away. Absolutely fabulous. Thank you so much for sharing your experience. So on to the next, we do have 2 more speakers to go. And so let me introduce you our next speaker, still talking about practice, but of young pharmacists group in it as well. So welcome, Anisha Sandhu. She's a registered pharmacist in Australia and New Zealand who has worked in patient-facing roles, mainly in geriatrics, before joining academia in early 2000. She lectures all pharmacy practice and experiential units, as well as while also leading the interprofessional education and the Monash model of care portfolios at Monash, Malaysia. She's also the FIP YPG Workforce Development Hub Liaison and assistant lecturer at Monash University, as mentioned before. So welcome, Anisha. The floor is yours.
Thank you very much for the kind introduction, Andrea. I hope you can hear me clearly. So today I hope to take you briefly through the pharmacy registration journey in Malaysia, existing support structures, gaps identified, as well as how the FIP YPG, as I will be referring to the FIP Young Pharmacist Group, can lend support to early career pharmacists worldwide. Pharmacy graduates with an accredited undergraduate pharmacy degree who qualify to become provisionally registered pharmacists generally undergo provisional training in approved clinical, community, or industrial sites for a year in Malaysia, followed by another year of attachment. And during this training, they usually undergo a series of learning modules. They fill out assessment sheets, Clark cases in the official logbook, and they will also receive continual appraisals from their preceptors. They're also required to pass a qualifying examination based on legal ethical principles before achieving full registration. I'll get you to click next, Andrea. So overall, after graduation, young pharmacists in Malaysia receive early career training with a strong emphasis on the provision of competent pharmaceutical care. And I'll get you to click next, please. This ties in with the principles of pharmaceutical care and public health in the FIP's Global Competency Framework, or GBCF, as I'll be referring to it for the rest of my presentation, where early career pharmacists are trained on the assessment of medicines, safe dispensing, providing therapeutics and monitoring expertise, providing health promotion, medicines information, and patient education. Next slide, please. So the Malaysian Pharmaceutical Society actually plays a large role in creating support structures for early career pharmacists in Malaysia. And this is really available through the active engagement of the Young Pharmacist Chapter, or YPC, as I will refer to them, and the Malaysian Pharmacy Students Association. So these organizations actually work very closely together to provide a range of regional networking events, conference, forum, digital events to involve young pharmacists and students. Student membership categories are available to encourage pharmacy students to join. There are national pharmacy challenges that are held, competitions as well annually to encourage skill development, whether it be in clinical skills, knowledge-based competitions, or even oratorial challenges on health issues. And as has been advocated by the FIP's leadership for early career pharmacists, where they encourage us to take ownership of our future by engaging with professional pharmacy organizations to redefine pharmaceutical care, the Malaysian Pharmaceutical Society's YPC, or Youth Pharmacist Chapter, helmed by young Malaysian pharmacists, or future pharmacy leaders, as I would like to call them, actively contributes to the FIP YPG events, projects, and publications to provide educational training and support to early career pharmacy workforce. The Malaysian Pharmaceutical Society has also dedicated continuing pharmacy education and professional development chapters that organize numerous events and workshops for continuing education. The Malaysian Academy of Pharmacy e-learning portal is also available, and in response to the rapid pandemic-driven digitization of education, they are now providing online, on-demand, anytime, anywhere learning. Next slide, please. So with these infrastructures in place, where is the gap in early career training strategies for our young pharmaceutical workforce? So if you click next, a quick refresher of the FIP, GBCF, and Global Vision for Education shows strong importance placed actually on personal and professional skills to address the evolving demands of the pharmacy profession. So in my opinion, specifically, in addressing these principles listed here from 4.1 and 4.2 to 4.4, 4.5, and 4.7, where we consider effective communication skills, reflective practice, interprofessional collaboration, self-regulation and resilience, as well as identifying limitations and social accountability. Next slide, please. So here at Monash University, Malaysia School of Pharmacy, together with our colleagues in Monash, Australia, we're actually committed to providing our best effort in preparing future pharmacists to join the pharmaceutical workforce. I'll get you to click next, please. To address the professional and personal principles based from the FIP's GBCF, so we have actually introduced and continually improved interprofessional education programs with the School of Medicine to encourage collaborative learning and practice. We've also provided dedicated career development workshops to final year students to provide insight and manage expectations on future career pathways. We're also committed to developing reflective practitioners via the career development workshops that emphasize the importance of reflection and introducing reflective writing practice throughout the curriculum. We have skills coaching across all year levels in the curriculum to develop core skills. And we've also identified via the pandemic the need to incorporate self-regulation or resilience training to create a flexible, adaptive future pharmacy workforce. Next slide, please. So as a representative of the FIP Young Pharmacist Group, a question I'm here to answer is how do we as YPG support early career pharmacists globally, and can we support some of the gaps identified? So in the world of pharmacy, the FIP acknowledges the pivotal role played by early career pharmacists and pharmaceutical scientists in defining the directional goal of the profession and addressing health challenges worldwide. This is in line with the strategic outcome number 6 of the FIP strategic plan and the One FIP vision in including the younger generation of early career pharmaceutical workforce in FIP initiatives. Increasingly, early career pharmacists are represented by national and international international youth platforms like that of the YPG that work actively to amplify their perspectives and concerns to drive positive change in healthcare at local and global levels. The FIP's continued engagement with YPG actually indicates clearly that to create a sustainable future in addressing evolving healthcare needs, we must think about who comes after us and listen to the voice of the future. So the YPG has played a significant role over the past 20 years, aligning together with the FIP to establish and facilitate connections and networking among the early career pharmaceutical workforce. Our goal is to foster leadership and enable positive change at local, national, and international levels. And we do that through a series of regional networking opportunities, resource building activities, workforce development projects, digital events, and working groups. For example, most recently to explore job and career satisfaction, identify gaps in education and training, gaps in soft skills education and development, as well as the impact of professional organizations in an early career context. So through some of these projects, we've actually created several resources and published global reports, 2 of which are actually displayed on the slide here. In the first, you can see the YPG Career Development Toolkit that was launched in December 2020. To create this resource, we had a global young pharmacists working group involved. And what we really aimed to do with this was to highlight different pharmacy-based career journeys, describe the career development cycle related to the FIP global frameworks, particularly that of Principle 4.2 on continuing professional development, explore the development of transferable skills, identify activities to support skill development, such as mentorship, early career training, certification, and networking. And the second resource highlighted here in this slide is the newly launched FIP YPG Global Report on the role of early career pharmaceutical groups in global health. This is a first of its kind report actually, and it engaged early career pharmacy organizations from 48 countries across 6 regions. And what we really aimed to explore here was young pharmacists' perspectives and the usage of young pharmacists' platforms to support global health. We featured regional case studies of early career pharmaceutical groups in the African, Eastern Mediterranean, European, Southeast Asian, and Western Pacific regions to encourage further development of youth pharmacist chapters in other parts of the world. All of these resources align with the DG2 vision of providing support to the early career pharmaceutical workforce. Next slide, please. So over the next few slides, just very quickly, we have a glimpse of some YPG-led initiatives to support the early career pharmaceutical workforce. The last a digital event series focused on career development for early career pharmacists and pharmaceutical scientists in line with the YPG Career Development Toolkit that you just saw from the previous slide. So this has included events exploring, reflective practice, smart goal-based action plans and continuing professional development cycles, discussing skill development, embracing a growth mindset, mentorship, as well as highlighting positive impacts of training and certification in career progression. Next slide, please. In fact, just 2 days ago, we also invited an amazing panel of speakers to inspire our members with their career progression pathways to encourage deeper reflection of pharmacy careers. And next month, we'll delve a little bit deeper into this in our next webinar on career paths and opportunities in the pharmacy world, which you're welcome to join. Next slide, please. We have also organized a digital event series focused on global networking of early career pharmacy-based professional organizations together with youth pharmacy chapters worldwide, as well as student pharmacy associations as well, Start Them Young, particularly with the International Pharmaceutical Students Federation or IPSF. Next slide, please. In our effort to provide a supportive infrastructure and resources to early career pharmacists worldwide, we have actively engaged with the FIP leadership. This includes DG2, the wider Workforce Development Hub, FIP sections and SIGs, to create an annual leadership development program, as well as a global mentorship program, the 2021 intake of which just kickstarted this week. So our members are actively involved in health promotion and advocacy, remote volunteering opportunities, and other working group opportunities as well. We hope to launch early career education focused projects as well. And meanwhile, we've also held many regional networking events. So here on this slide, you can see a recent networking event held with the Kenya YPG members. And if you click next, you can also see the Zoom networking event that we held with the Malaysian Pharmaceutical Society's Youth Pharmacist chapter. Next slide, please. So I'll end my presentation here with a quick explanation to any audience member eligible and interested to join the FIP YPG that we welcome all pharmacists, pharmaceutical scientists, pharmacy educators, pharmacy students under the age of 35, or anyone who's graduated less than 5 years ago with their first degree in pharmacy. The membership fee to join FIP YPG is very much dependent on the country that you're from and may range from 19 to 50 euros. We're very active on social media, particularly on LinkedIn, and we welcome you to follow or join our social media. And we can also be contacted via our social media, or the membership form should be available on the FIP website. Thank you very much.
Thank you. That's lovely, Anisha. And thank you for providing not only the perspective of Malaysia, but also with YPG. Unfortunate, I have to say that I can no longer be a young career pharmacist. I don't know why. I should have. But I do follow your social media. I do encourage all the participants here at the webinar and whoever is listening at home after to follow the social media. At least it is definitely the future pharmacists for us and our future main workforce. So they are doing amazing things, and they are sharing our profession and enhancing and improving our profession even further. So thank you, Anisha, for those lovely words and your presentation. Moving on to the next element of this webinar, which is the science element, and our last speaker of today. So the science element is about education and training of graduate and postgraduate students and early career pharmaceutical science to invest their skills in basic, translational, clinical, and regulatory sciences. As mentioned before, the mechanisms to do that is to develop mentoring programs that connects trainees in early career pharmaceutical science to qualified mentors with experience in academia, industry, and regulatory bodies. Establish dedicated discussion forums for trainees and early career scientists to facilitate networking and professional development opportunities. Without further ado, our final speaker of today, and hopefully we'll have time for some Q&A at the end, is Belma. I do apologize. I will not be able to say your last name correctly. Pelhavanovic. Not close enough. You will say it even better, so I do apologize in advance. So Belma has graduated from the Faculty of Pharmacy, University in Sarajevo, in 2014, where she obtained a Master of Pharmacy. In July 2020, she became a doctor, and her current research focuses on preclinical studies and cardiovascular pharmacology. So in that case, without further ado, and also apologies, she's the YPG FIP liaison for the YPG WISE movement, and as a remote volunteer. She currently teaches and is a research assistant in the Faculty of Pharmacy, University of Sarajevo. So welcome, Belma, and without further ado, the floor is yours. Thank you.
Thank you very much, Andrea, for a kind introduction. And my surname is very difficult for native speakers, so thank you very much. I'm very happy to be here today and happy to have the possibility to tell you experience from Bosnia and Herzegovina and tell you what does it mean to be a pharmaceutical scientist here and what do we have here and what kind of things we are missing and what we are currently doing. So basically, if you want to be a pharmaceutical scientist in Bosnia and Herzegovina, you are a very lonely person on a very difficult road. By being a very lonely person, well, there are not much pharmaceutical scientists here, as majority of pharmacists are community pharmacy, and other part of them works in part of the pharmaceutical industry or wholesale academia, or a very, very small part in hospital pharmacy. Unfortunately, our country does not provide by national register. There are no data to tell you the exact number. So if you decide to go on this road and to become a pharmaceutical scientist, you need at least 5 years of integrated study where you obtain Master of Pharmacy. But for the most positions in pharmaceutical science, you need a doctoral degree with certain years of experience. I would just like to point out that in my country, as in every other developing country, as we are a middle income developing country, by being a researcher or just pursuing a career in science, is very luxury thing to do, as everything has its economic and political constraints, and it all goes away to even your career development. On the next slide, I will present you what are the programs that young pharmacists, young graduates can do, and on their road to becoming pharmaceutical scientists. So basically, after obtaining the title of Master of Pharmacy, you can have this part of a doctoral degree, which lasts for 4 to 5 years, and you have your PhD in science. Meantime, or after obtaining PhD, many of our colleagues go to different residencies. Now, these residencies are conducted by the Ministry of Health, and you have different areas depending where you want to profilate yourself, whether it's at clinical pharmacy, quality assurance, technology, dermatology, pharmaceutical care. So there are a few of those residencies which last 4 to 5 years, depending what you choose. There is one national program that is committed to academic researchers, so it's not only given to pharmacists. It's called TRAIN program, Training and Research for Academic Newcomers, which provides certain skills and development for being a researcher in academia. It lasts for 6 months, and basically it consists of 3 models. Besides this program, pharmacists and pharmaceutical scientists in Bosnia and Herzegovina have different fellowship workshops, short-term education, which are provided mostly by the private pharmaceutical companies, or less of them are provided by National Chamber of Pharmacists in order to obtain credits for your license. On the next slide, I wanted to demonstrate to you what is actually missing in our country. What is it, what we need to do? So basically, we don't have any national training, no career strategy for pharmacists, you know. So it's a problem on the national level, due to political, economical constraints, it's difficult to make something national. But for parts of state, there are few guidelines that are made for career strategies, but again, not particularly for pharmacists. So the main issue here is that we don't have national training strategy, nor do we have continuing professional development training programs. As a pharmacist, that's the main issue what needs to be introduced to the country. It's the main thing that needs to be provided, as our fellow colleague has said, in Malaysia. So basically, you need to start the journey by providing this essential 2 things: national training and continual professional development programs. What we are missing, and what is something that younger pharmacists are really expecting, is mentorship programs. As well, basically, you're left on your own. Okay, so if you are a pharmacist, pharmaceutical scientist, pharmaceutical research, you do things on your own. In my personal experience, I had the most of that help from FIP and YPG. So they were like guidelines of what you need to do, and you have those national programs to have mentorship and mentoring programs. But in Bosnia and Herzegovina, there are no such things. So there are nobody to guide you. That's something that needs to be changed. And if you decided to have a postdoc, or if you want to pursue postdoc, you cannot do it because it doesn't exist. So for my postdoc, I'm searching for abroad opportunities, as in my country that is not defined. It is impossible to have a postdoc. It doesn't exist, and it's something that needs to be changed. Lately, we have introduced different international and Erasmus exchanges in order to obtain international experience and networking. That has to be even better pursued, because it's not enough, you know. So, but we do have certain exchange programs. What else is missing is leadership and self-regulation, personal development, or to pursue this competency together with digital and technical competencies. So basically, and at the end of this part, what is missing, what every country needs, including Bosnia, are fundings, equipment, and infrastructure. So basically, we are now seeking for this scientific capacity building in order to be competitive and in order to have a better networking. So what are the programs that are currently in Bosnia? We have TRAIN, as I already mentioned. It's a training and research program for academic newcomers. It actually provides strengths and competency for academic research staff at our university. There are different models. They are not only part of scientific model or research model, but they are also have its educational model and development of communication skills and networking. The objectives of this program are related to the knowledge and skills of researching and teaching staff of our university. They are consistent with these three models, which you can see on table 1. It's part of the educational process, research and development of communication skills. But however, I would just like to point out this program is not particularly for pharmacists, it's only for all academic researchers. On the next slide, Andrea, please. So on this slide, there is a new program that has been launched this year. So basically, Bosnia and Herzegovina is a members candidate state for European Union, and in order to be a part of European Union, you need to make changes to your educational system, and this is good for us because now we have this IQ Farm, which was co-funded by European Union and Erasmus Plus program, which is a national program that is now developing researcher, that is developing academic staff, their professional competencies for more interactive and more practical approaches, so through different experience, and to basically obtain better practice for them and to have better program institution and active involvements in different parts of rail sector. So one of the aim of this program is also to improve different courses to delivery of the production of assessment tests, such as knowledge retention evaluation framework or objective structure clinical examination. Important objective of this IQ5 program is improvement in experimental education and development of pharmaceutical professional training and e-platform for EE management and administration. The main part of this IQ Farm is also that it gives us fundings for capacity building, which provide us with new equipment and more infrastructure to pursue better scientific researchers. On the next slide, we wanted to highlight how basically we are able now to enhance competencies of early career pharmaceutical scientists. So the basically is first to evaluate the needs of professional development, and here they are in collaboration with Global Competency Framework. So the first part of this is to make collaboration and networking within research centers, whether it's industry, drug regulatory agency, to provide some sort of exchange experience, whether it's a short-term research or fellowship for young pharmaceutical scientists. One very crucial part for our country is to develop mentorship programs. So guidance of young people is the crucial part of this, to provide them and to see them what they are actually capable of doing. To develop specialized programs that advance skills in basic translational and clinical fields, to develop programs and platforms for science and communication, to have things such as increased international collaboration, exchange, to create different digital platforms for support, for information, Q&A part. That's something which we all collaborate and which we all can rely on global competency framework. Here are their tips. And of course, as in every country, to seek for increased funding and grants for research, for publishing, for training, because I'm not sure is the situation similar in your countries, but in mine, if you decide to publish paper, you have to, like pay it for your own, you have to fund your own research because it's a very limited number of research. So we are now happy because IQ Farm can provide us with additional funding so that we can really pursue science as we want. On the next slide, as we have identified the needs and what is needed for young pharmacists, pharmaceutical scientists in their professional development, here we have what's actually needed to be done. So as Francisco has said before, Malaysia is a country in a journey, while Bosnia is just about to start the journey. So I'm sure that we will learn a lot from our colleagues by first creating strategies and guidelines in implementation, then following different guidelines such as GBCF, FIP IGP, and different similar guidelines, to develop these professional competency handbooks or digital platforms as we are trying in first, and to do implementation of continuous updating and advancing skills and competencies. And as for conclusion, I just wanted to rely on the European Charter of Researcher that no matter what stage researchers are, at different stage of their career, they should seek for continuous improvement themselves by regularly updating and expanding their skills and competencies. So this is achieved by a variety of means, including, but not to be restricted, whether it's a formal training, workshop, conference, or e-learning. But it's a lifelong process, and you all have to do it. Thank you very much for your time.
Thank you, Velma. Thank you so much for that very kind presentation. And again, it's all about considering all elements of the workforce. And you briefly and very eloquently explained the science bit and how the GBCF actually match the scientific part. So thank you so much. I'm now inviting all the speakers to join me in this panel discussion. I will stop sharing my screen so we can all see their lovely faces and you can talk to them. I've been, Chris, if you'd like to join, you are most welcome to join us on screen as well. Chris will be doing the final part of this webinar shortly. So I do believe we have one question in the Q&A, and that's specifically to Asma. So I'm going to ask you, Asma. We have a question from Judy. Is there a specific number of units CPD required in Kuwait to continue pharmacy practice?
Thank you for the question. No, we don't have yet a mandatory CPD for pharmacists. However, Ministry of Health is working now on making this mandatory. However, before making it mandatory, we need to train pharmacists because it won't be fair if it's a new concept for them. So the short answer, no, we don't have specific number of hours. However, we are working on it for future.
Thank you so much, Asma. Are there any questions from the floor? We do have a couple 4 minutes to spare on this panel discussion. I do want to thank you all. While I know that it takes about 15 seconds to 30 seconds to type a question, so I'm going to fill in that time a little bit with thanking you all who have participated as participants in this webinar. We do have someone from Jamaica, and it's supposed to be now 5 a.m. for her. So thank you so much for joining us at 4 a.m. in Jamaica. We have countries such as Denmark, UAE, India, Nepal, Cape Verde, Bulgaria, Bahrain, Philippines, of course, Australia, UK, Egypt, Sri Lanka, and Indonesia, and Armenia. I'm just looking at it now. So thank you everyone for joining. And we do have another question. A question, I believe, to Asma. Okay, this is a very specific question that I might ask Asma to do it offline, because they do ask how to manage allergic manifestation leading to asthma. So I do believe that's going to be offline. I'm just going to focus on the developmental aspect here. So we do have one question. How do we ensure that advanced training programs post-registration are recognized interprofessionally and internationally in order for them to be consistently effective, sufficiently incentivized and robust over time, and they should be formalized and incorporated into legislation and the healthcare structure? So may I ask Ian, that you have more experience on the advanced programs to reply to that question, mainly about how can we do this, that it's interprofessionally recognized, and of course internationally.
Excellent question, Donica. And look, certainly in Australia, in a number of the advanced training programs for people working in specialized areas, be it in general practice, emergency medicine, infectious diseases, we actually have the medical colleges input to the advanced training curriculum, so which is really the advanced training framework. So your first part is exactly right. There's no point in us developing pharmacists to deliver rheumatology outpatient clinics if the rheumatologists aren't endorsing this as being their knowledge and skills and attributes. So totally support that. Your point internationally is really well made. And I think the common point that has come out of a lot of these talks today and tonight and this morning is actually the fact that we all map back to the same international competency frameworks, number one. Number two is that I think there's also some good work that's been going on between different countries. So we've sort of had a memorandum of understanding between Australia and the Royal Pharmaceutical Society, as well as FIP at other times, to actually recognize, because I think that's really important, that when pharmacists move from one part of the world to another, if we're all showing our evidence in our portfolio mapped back to the same international competencies, then you actually, as a manager and as a leader, I have confidence and assurance that I know what I'm going to be getting. So I think I totally support your recommendation. You've clearly got a fantastic big picture view, and I hope you're managing to input this. But potentially assume this might be in Ireland based on your name, but I think it's a really fabulous idea, and it's something which, you know, as from an FIP point of view, I'm sure we'd very much support and endorse. And from an Australian point of view, and wearing my UK hat, it's what we've also tried to support. But I think having our medical colleagues support, be it our general level, our competency frameworks, as well as the advanced frameworks in different specialty areas, is really critical and really important. Great point.
Thank you so much, Ian. I don't know if any of the other panelists would like to add. I would just want to add that within FIP, there is something that it's called the Workforce Transformation Program that Franciscus actually mentioned in his presentation. And I would encourage you to have a look at it, to find more information on FIP website that can help you, especially with the international aspect of your question. So thank you for that question. We do have another question, and this is for Franciscus, but also I believe could be for Anisha, because it does ask, does YPG also partner with schools outside your country?
Thanks, Andrea. Yeah, I did see that question in the Q&A box. I believe with regards to partnership with schools, that's probably more along the lines of what IPSF or the International Pharmaceutical Students Federation would be doing. YPG actually works more with early career pharmacist professional organizations. So we're looking more at youth pharmacies, youth pharmacy chapters regionally. However, you know, if there is any ideas or collaboration ideas that you may have that you want to approach us with, I'm sure we'd be more than happy to entertain.
Thank you so much. I do believe that it's said for Franciscus, but I think it's mainly to do also with Shirley being very active with the YPG in Indonesia. So thank you so much. If there are no other questions, and due to time, I know that Chris needs exactly 7 minutes to do his part of the presentation. So I'm giving you exactly 8 minutes to do that part of the presentation. I will start sharing my screen again. If you do have other questions, please continue to add them in the Q&A box, and we will address them as soon as possible. So let me just go back to the presentation and share my screen again, so that I can give the floor to Chris. Chris, would you mind presenting yourself while I'm trying to share my screen? Thank you.
Of course,
the floor
Andrea.
is yours.
Thank you. Hello, everyone. And this will be very brief. I will do it in less than 7 minutes. But thank you for the 7 minutes, Andrea. I am Chris John, lead for data and intelligence at FIP, and we have an interesting activity for you to take part in just at the end here. But this little session is about monitoring and evaluating Development Goal 2. And key to that is the FIP Global Pharmaceutical Observatory. The GPO's mission centers around data, intelligence, advocacy, and reporting. We know the importance of data, and if ever have we known the importance of data than we has been during this pandemic. But the importance of data, and for data to provide us with evidence, and for evidence to provide us with intelligence. And that equally applies to Development Goal 2, early careers training. So our first task is always to collate valid global data on workforce, education, practice, and pharmaceutical science. We must also undertake comprehensive analyses of collated data to provide accessible, high-quality intelligence. And all this must be communicated innovatively to promote our pharmacy colleagues and member organizations around the world and their impact on health. This communication will often be via the FIP Atlas, which is our visualization platform for displaying our intelligence and data across the globe. And finally, we'll provide evidence-based strategic information reports and guidance on the application of pharmaceutical science, policies, practices, and services. Next slide, please. In the interests of time, I won't go through all of these points, but this slide shows you the FIP GPO's outputs and influences. And I've mentioned sharing and disseminating intelligence, but you'll see there are lots of other outputs and influences. The key reason why we're here today, and if you look at the bottom bullet, is for health systems strengthening by tracking progress against development goals. Current GPO activities and projects, again, are on the screen now. I won't go through them all, but you can see there's a range of projects going on, from multinational education and training needs assessment projects that we've been undertaking with a cohort of nations. I've mentioned the Atlas dashboards. We've built a GPO database for all the data to go in, and we have a microsite, a website in development. And all of this is supported by the Data Intelligence Commission, who are our key strategic advisors for our work. But again, the main reason why we're here today are the development goals and developing development goals indicators, which is vital for tracking progress. So here is the short engagement activity we would very much value your involvement in. FIP is now seeking to develop indicators and country level metrics to measure and monitor progress and the performance of implementation of the FIP development goals via the FIP Global Pharmaceutical Observatory. Today is development goal 2. So during this event, and now if you would like to take the moment to do it, we would like to seek your support for this global indicators and metrics project by contributing to this brief activity linked to the current FIP digital event on development goal 2 that you've joined. All you need to do is click on the link or scan the QR code, and that will take you to a quick exercise where you can tick some boxes and let us know your views on how this development goal can be tracked and measured. You'll also receive an email to complete this activity after the end of this event if you don't get the chance to complete it during this event. So that's everything from me, and I will hand you back to Andrea. Thank you very much.
Thank you, Chris. That was less than your 7 minutes. So thank you so much for doing that. I do encourage everyone, you do not have to do it now. It's very easily, I will go back to the link. Ooh, sorry. I'll go back to the link. It's very easily to, you can do a screenshot or even just take a picture of it. It's bit.ly FIP DG 2. I do encourage you to do this short activity. It shouldn't take you more than 5 minutes to do, as Chris was mentioning it. And it's very important for us to continue to support all of us and all of you as well. So just to finalize, we do have 2 minutes at the very end. It's to highlight the next episode of this webinar series. It's about patient safety. It's about DG number 19, and it's on the 17th of September. So the timing is 3:30 to 5 European time. So I do believe you can look at that. Just to encourage you also, if you haven't done so, I do believe we have lots of people that have already, and I encourage all the participants here to join us on the World Pharmacist Day, which is on the 25th of September. And it is now on its 11th year. And it's an opportunity for our profession to make a vital role in improving health, knowing in every corner of the world. We are having this highlighted this time, and I would encourage you to have a look at the campaign and to show also your appreciation for our lovely and wonderful profession. Just to finalize, all of these events you are able to look at previous recordings and upcoming events on the page of events.fip.org. It's all about FIP digital events. And as I mentioned early, this webinar We do have a lot, and we have focused on these series on the 21 development goals, but there are other topics such as antimicrobial resistant, non-communicable diseases, vaccination, patient safety, and others that you can find on this particular website. Let me just finish off by saying thank you for everyone. I will stop sharing my screen and encourage all of the panelists to come back online with their videos, and I will double check if there's any other questions. I don't believe there's any other question, just fantastic feedback from our participants to you, your panelists. Thank you so much for participating in this webinar. It truly was an honor to be your moderator. You've done such an amazing job. And if you'd like to say anything at the very end, we are on time, bang on time. So if participants leave, I do understand we are final on time. And if anyone would like to say any final words, the floor is yours. And thank you, everyone. Oh, and the United States as well is represented at 4 a.m. So thank you so much for this ungodly hours that you join us instead of watching the webinar. So do thank you from me.
Thank you so much, Andrea. Fantastic facilitation, and thanks everybody else for their participation.
Thank you for this opportunity to share experience. Andrea, thank you.
Thank you all for joining us for in DG2 event, and thank you, Andrea, for a great moderator.
Thank you, everyone. Thanks, Andrea.
So thank you, everyone. I will switch off now. Thank you for all the participants. Thank you for the backstage helpers, Dalia and Mila. You are fabulous and supporting and creating all of this in the background. It's really important. Without you, we wouldn't be able to be here all together. So thank you, everyone, and bye for now. See you in the next event.